Dr. Feigelding, thank you very much for joining Rudaw English. There is encouraging news on the race to develop a coronavirus vaccine. Moderna is set to start its final stage of testing by the end of this month. This is promising news, is it?
Yeah, I think it's very promising. We're seeing a lot of good progress on many vaccines. Moderna is just one of them. There's also the Oxford vaccine group that's being tested in Brazil. Just recently, they announced that the Oxford vaccine actually has discovered it has double properties for both increasing antibodies as well as T cell responses to the virus, which, with this double benefits potentially to fight the virus, the vaccine will be very successful. And the Oxford vaccine is currently being tested in Brazil. And altogether, there's over 120 vaccine being developed. So I think we will hopefully get some vaccine by the end of the year, at least for emergency workers.
And widely available in the US and globally. When do you expect?
I think initially the availability will be very limited, again, just to healthcare workers and essential workers. Over time, I think it will be rolled out to more and more. But this is why there's a lot of things in terms of, will we find one that is fast enough to produce in billions of doses? And these are all open questions that we have to ramp up production once we have the successful vaccine. Hopefully by spring next year, we will have it available for everyone around the world.
If vaccine was widely available and globally and in the US, does this mean the end of the pandemic?
I don't want to count my chickens before my eggs hatch, but I'm hopeful that the vaccine will bring an end to the pandemic. Hopefully, it will be effective for people long term, but maybe people will need boosters. Hopefully, its effectiveness is high enough that it can stop the epidemic by itself. If not, it might still require some additional public health interventions, and hopefully enough people take the vaccine so that it will convey immunity to enough people in the population so that the virus will stop spreading. Lots of unknowns.
Dr. Feigelding, I've been following your Twitter account since early February, where you were one of the few very vocal scientists giving us warning about this virus, which unfortunately turned out all to be true. Where are we right now? I know it's very hard to predict future, but based on your expertise, did we pass the worst stage of this pandemic in the United States and in a global scale?
I think this pandemic is actually getting worse. The worst, I think, is still ahead of us in many ways. We have more infections now than ever before. And some people say, well, we didn't have enough testing a few months ago. But given how fast it's been spreading and how the positivity is soaring again, I think the spread is clearly much worse than before. And it is in almost an unstoppable, unchecked situation in much of Latin America too, in addition to the United States. Because once a wildfire burns out of control, it's hard to stop it again. But the Europeans and Asian countries were able to, for the most part, stop it early. And now they're enjoying a lot of respite. But if any country stays infectious, the whole world stays in danger until we have a vaccine.
What did the Europeans and some of Asian countries did right that the others didn't?
Right, that's a very good question, and people are analyzing that. I think clearly they tested early, because it's not just about how much testing, but when you do it. The earlier you do it, the better, because testing leads to early isolation, testing leads to contact tracing, and aggressive contact tracing that a lot of the Asian countries were able to do, as well as quarantine and separate quarantine for people who are infected, because oftentimes family members infect other family members, which is actually a real danger. Altogether, they reacted fast, and that is the key. They reacted fast and swiftly, and people complied, and the government incentivized the population to stay home with a lot more support than a lot of other countries have provided. And altogether, they have paid dividends, and their schools are reopened for the most part. And with the exception of Israel, I think a lot of countries in Asia and Europe have done pretty well.
And Dr. Feigelding, you about masks, which is a topic that has been widely discussed here in the US and around the world. When mask is mentioned, they talk about protecting others. Wear the mask to protect others. How protective it is for oneself when they wear a mask? Is there any data and we have about that? Yes.
There are many different kinds of masks, I want to emphasize. There are cloth masks that everyone's now advised to wear. There are surgical masks, and then there's a high-grade N95 or above masks. And the N95 masks are better, they're called respirators, are better than surgical masks, which are better than cloth. But they're all effective for catching droplets. And now we know there are 3 different kinds of infection. There's fomite, which is surface to touch surface when you touch a door handle and then touch yourself. There's droplet, which is large drops of saliva. But this falls down according to gravity's pull. This is what we also call ballistic action of the droplets when you cough, sneeze, or talk. But now we know there's aerosols, these micro droplets that stay in the air for 20 minutes, 4 hours, and if the room is stagnant for 16 hours. All this, whether it's big droplets or micro droplets, are caught for the most part by masks. And this is why masks are so critical. And while the cloth masks don't prevent you from inhaling a particle, if everyone wore masks, everyone would stop it. So my mask protects you, your mask protects me. And this is why we need universal mask compliance, not just isolated cloth mask compliance.
And without the universal mask compliance and mandatory, for example, in the US, do you see any way we can control the pandemic here?
That's very difficult because I think mask is one of the most critical and easiest things to do. There's distancing, but that is very painful economically, socially, and for our children. There's obviously drugs, but drugs are not a good solution. We need ventilation. We need improved ventilation in various workplaces because we know from choir, singing, and other epidemics that it really is a lot of these indoor, poorly ventilated places that leads to this kind of infection. Altogether, masks are the easiest. Testing and contact tracing are also good, but testing you have to do at a low of enough volume that your public health infrastructure can handle the amount of testing and contact tracing to find everyone that person was exposed to. And that is obviously, you have to do that early, not at a higher volume when it's late. So altogether, certain things, if you do it early, it's much less painful. But once it gets out of control, it's very hard to stop. And mask is one of the few things that can do it short of a lockdown.
You spoke about ventilation. There are now talk about AC, like some ACs are risk factors. How accurate are those reports?
Air conditioning is a real concern because many air conditioners recycle the air instead of blowing new air out from the outside and then old air out as well. So this is inherently the problem because if you blow air that is not sanitized, and oftentimes now there's a push for UV sanitization of all air coming through an air conditioning unit, but that's obviously not available everywhere. So unless you bring in fresh air from the outside, air conditioners are actually very risky because if one person coughs, it can potentially spread the micro droplets to many different parts of the building unless the air is purified in between.
Yeah, and this obviously gets you to a higher risk during summertime because everybody's using AC.
Yeah.
And one thing that you warned about early on is about the aerosol, that this virus can transmit through not just droplets. And this was contrary to the World Health Organization's still recommendation. Now they are saying we are studying it. You're one of the scientists who asked them to change their recommendation. What do you think stopped the World Health Organization to go that far, or not just them, the other authorities? And how big is the risk of aerosol transmission?
Yeah, this has been a very controversial topic. Aerosol implies airborne, and the World Health Organization has been very hesitant to admit that this is a major route. Previously, as I mentioned, there's 3 routes. Previously, the World Health Organization only recognized the foamized surface to surface, as well as the droplets. But the aerosol, they withheld it until 239 aerosol scientists wrote a demand letter to the WHO to recognize it. And there's a lot of internal politics somehow why they don't recognize it. Now they somewhat do, but they say it's a possibility, but they still dismiss it as a major contributor. Meanwhile, other aerosol scientists are saying it's 50% of all transmission. Because what happened in one choir singing example, 55 people got infected. But the person who infected them all, the one person, was only within 6 feet of 1 or 2 people. And he or she would have had to basically cough and spit on 50 people in between the 10-minute breaks. And that's just not possible. That implies that it was an aerosol transmission, airborne transmission. And this is the real concern. And there's a growing movement that WHO has to recognize this more, and we take precautions for that. This is why the new ventilation push, the new UV light to disinfect the air passing through the air conditioning system is so important. And returning to schools without all these considerations, it's extremely risky. So WHO is a little bit conservative, and sometimes in absence of solid, irrefutable evidence, they don't act. And this is obviously something we have to someday, reflect upon. Was the basically the prudent principle of taking precaution early actually perhaps better in the future?
And this basically makes opening up schools very risky. When do you think is the right time to open up school? I know this is a very difficult question everybody is asking.
No. The right time is not a specific date. The right time is when the epidemic is low enough. Like, there are examples of safe reopenings in Denmark, Norway, Austria, and then there are very dangerous examples such as Israel, where Israel's deputy health chief epidemiologist says more than half of all the epidemic was due to schools reopening. It depends on how low the epidemic is. If it's a very low background level, I think potentially it can be safe if we do all these other children's mask wearing, which I know is difficult, plus ventilation and these air purification. But if it's raging hot inferno right now in many parts of the U.S., such as Florida, Texas, Arizona, and the Sun Belt, then I think it is extremely, extremely risky. So we can't open and get our kids back until the epidemic is under control.
How risky is being outdoor? This indoor-outdoor comparison.
Yeah. Outdoor is definitely safer because, first of all, the UV light from the sun, the natural UV light, will basically kill the virus pretty quickly. And the air volume outside, one gust of wind has more air volume than all the air that your large building can produce in one day. It's the amount of air volume is what actually protects us from it. As they say in environmental health, the solution to pollution is dilution. And the dilution with a huge volume of air circulating outside will actually be the thing that protects us. That said, we should still wear masks, especially in places like crowded concerts, crowded sidewalks. It is just still a very risky situation. So I wouldn't attend sporting events necessarily and sit next to thousands of shouting people without masks, even if it's outside.
Absolutely, and that brings me to a question of the New York keeping the restaurants indoor banned. The city is opened up in many ways, but the indoor dining is still banned. And New York has been talked about as a success story, despite the fact that we have thousands of deaths. But the rates are down. This week we had, for the first time, 0 death. New York didn't do things that was done in Europe and in Asia in that strict way. What do you think was the contributing factor for the success in New York and lowering the rate in this way?
Yeah, New York had a very bad epidemic, but New York went into a full lockdown, as you recall. Schools were closed, all businesses were closed until most of this came to an end. And New York has also reopened very slowly. And also mask compliance in the Northeast is extremely high. Mask compliance in the South is extremely low. It's becoming that the mask has become a political symbol, and whether you support Trump or not. But also, I want to remind people, it's kind of like people believe what they can see, right? And everyone in New York knew someone who had the virus or died from the virus. And so when finally mask orders came down, lockdown orders came out, people took it very seriously because they saw their friends and neighbors being hurt. But in the South, people did not, because back then the epidemic was not in the South for the most part, other than Louisiana. And people didn't take it seriously. And so now the flare-ups are where people didn't take precautions. So altogether, there's many lessons to be learned. But New York is not out of the woods. We know that countries can rebound. Like Israel had almost crushed the curve, but then they reopened too quickly. And now Israel has a raging wildfire, just like the US.
Yes, and that brings about the risk of second infection. There's a lot of people who got infected in New York City and feel now confident more about this virus. Do we have documented cases of second infection?
This is a very controversial issue right now. There is some evidence that people could get serially infected. It's still very preliminary. For the most part, we believe that if you're infected once and you survive and recover, that you'll develop the antibodies and immunity, other T-cell immunity as well, to fight off the virus again. And there's some evidence also that if you previously had one of the other common cold coronaviruses, that you're also partially immune to this one. But it's very variable. If you're asymptomatic case, which is up to 50%, some estimates say 25 to 50%, you have a much weaker immune response than those who had the full-blown disease and then full-blown recovery. So it's hard to say, if someone is fully protected again from another infection. This is the fog of war that we're living in. We're trying to learn about the virus at the same time that we're fighting it, and there's incomplete information that we will learn soon. And things like the airborne aerosols, the masks, these are things that we're learning and adapting to because of new science that's coming out.
Dr. Feigelding, there's a lot of information out there online about things you can do to better prepare yourself or prevent an infection, like vitamins, like other even solution or supplements that talk about. Is there any scientific basis for these claims?
Well, there's indirect scientific basis for many of them. Again, this is a brand new virus. We do not have direct evidence for all of these potential treatments and preventions. But I will say, like vitamin D, we know that it works against cytokine storms in tuberculosis, which is another lung disease. And although TB is not a virus, the cytokine storm is very similar, that leads to the need of mechanical ventilation and deaths. And we know that vitamin D can help with that. But do we have evidence that vitamin D prevents or treats this illness? Not yet. We know that zinc can help with common cold and other respiratory diseases. But do we have direct evidence for this yet? And especially in terms of randomized trials? Not quite. But I think our group is actually potentially trying to do one of those projects. But I think the evidence is out there that it could potentially work. And I want to just say, it's not like hydroxychloroquine, where right now, first of all, it's a drug that has a lot of adverse events, and there's trial that says no. And if you take it, potentially there's heart disease problems. But with vitamins, I think for the most part, I would say, what do you have to lose with most of these vitamins, especially these over-the-counter multivitamins? There's not much to lose, and I think, in terms of risk-benefit, I think it's something you can consider. But to be clinically recommended, we still need the data, and that takes time.
And last thing I wanted to ask you is, there is a lot of skepticism when it's come to science in this pandemic. Although I think majority of people still trust science and they go for experts. And for someone that I've seen your tweets, I've seen your interview, you are very good at communication, but I don't see that much from in a larger scientific community. Do you think part of this problem is lack of communication between scientific community and the general public?
And I think scientists are not really trained in communications for the most part. There is some who are science communicators, but oftentimes what they think of science communication is translating results for a reporter or translating the results of their study. But I think here, especially in this pandemic, what is needed is not just translating your research from the lab bench to a newspaper or lay audience. It's to actually translate it so that people are compelled to take action. Like, not just the mask potentially has some evidence of like, no, the masks work. If 95% of everyone wear it, we can stop the epidemic in 2 months and save $1 trillion or more. It has to be that clear that if you want to live, wear the masks so that our kids can go back to school. And I think this kind of translating for action to tell not just the lay people to wear masks, but telling government leaders like governors to impose mandatory mask orders, that kind of advocacy is oftentimes not, most scientists do not have that kind of experience. And so, I come from a different world of, I've been at Harvard School of Public Health for 16 years, but I've also been in the political and public policy arena to know what is needed to convince people to take action. And right now, we need people to take action, especially prudent action, even when we don't know everything for sure. But every second that passes, the virus will win. And we cannot wait until we know single thing for absolutely certain before we speak out. And that's why I spoke out in January that this virus could be a pandemic, because if we had to wait until we were sure, it would have been too late. And I think alerting people early about what could be coming and what could be important is really critical right now.
Dr. Feigelding, thank you very much for this interview, for all the information. We really appreciate it. Thank you.